I'm going to go through some stuff about healthy bladder and bowel habits, but I think it's useful to go over why we might get these problems, especially as women. So some of the things that come up when we talk about this in the class that we often do, why do you think we get this as women? One of the biggest things that people bring up is obviously childbirth, so bearing children, carrying children on top and giving birth, as well as C-sections, because again, like I say, you're carrying baby on top of those pelvic floor muscles. Menopause, so the hormonal changes that we go through as we get older, so we have less estrogen and progesterone, so the actual vaginal tissues change when you go through menopause. So again, the vaginal walls are thinner, so there's not as much support there. So again, prolapse in the both post menopause and postnatal patients is very, very common, and the risk is a little bit higher in that population. Other things that sort of generally again, the way we're made, I think I said in that previous video with prolapse, if you imagine your vagina is that sort of soft in the middle, this princess, because of the way we're made, when we lift and we push and we pull, if we're actually not very strong physically, a lot of the pressure can sometimes come down sort of through that pelvis. So again, the pressure going down through there. Other things are chronic constipation. So if you imagine your vaginal walls again, you've got a soft wall, you've got a hard poo sitting on the back. And then straining, so constipation, pushing and straining as well. Other things are, other illnesses. We know there's some research with sort of chemotherapy, radiotherapy treatments, hypermobility, and then chronic coughs, asthma, hay fever, where you're coughing, and you're putting pressure down sort of again through there constantly. So good habits are getting on top of those problems that we've just talked about. Some of the things we can't have any control over. Menopausal, a nice tip is sometimes a topical estrogen in the vagina is quite nice because it helps thicken the walls. Postnatally, just being more aware of what you're doing and lifting and bending properly, and the neck, which I will go through as well. And good diet and lifestyle. So we're going to go through those habits now. So as we've said, some of those problems are avoidable and can be treated very simply with some of the advice that we're going to go through today. Fluids is one of the biggest things we're going to talk about with the bladder. So to help with overactive bladder and to help with straining and constipation, we need to be drinking plenty of fluids. It does depend on your body weight. I'm not going to do a calculation for you, but as a general rule, we tend to say at least 1.5 to 2 litres of fluid. Ideally water, but you can count tea and coffee. Caffeine can irritate some people, and again I'll go through that in a second, but we're not too exclusive on what you can and can't drink. Same with alcohol. Ideally alcohol and fizzy drinks, you don't want to be having them if you've got an irritable bladder, but it does help. So the way your bladder works, well, as I've said in another video, if you're not drinking enough, your urine is more concentrated, your bladder's more irritated, so you're going to want to go to the toilet more. So drinking plenty of fluids, not only to sort of help your bladder, but just help your tissues, your eyes, your liver and everything function properly. Another thing that's really important is diet. So again, to help with constipation. So constipation is really, really common, and often we see the two coming in together in our clinic. People think it's normal because they've been told what's normal for them is to go once a week. So the normal amount to open your bowels is 1 to 3 times a day and once every 3 days. Again, it does depend on the stool type. I'm just going to grab a stool chart. So as you can see on here, okay, so this is a Bristol stool chart. You can go on Google and have a look at one of these. There's different types of stool, okay. Ideally, we're going to be aiming for this type 4, which is smooth, soft sausage, so that you're not straining to pass. If you're coming up more towards here, we tend to say you're constipated, and if you're obviously down here, it's more towards sort of diarrhea, loose end. So ways that you can help with constipation, the biggest one that we've sort of gone through is fluids. So don't restrict your fluids, eating enough fruit and fibre, and sort of 5 a day. A lot of sort of guidance will say 5 a day, and we sort of assume again 2 vegetables, 3 fruit, or vice versa. Well, actually we should be trying to have more than that and varied. So you're looking at sort of 5 fruit and 5 vegetables. That might be too much for some people. It does vary person to person, but if you're struggling, generally increasing the fruit does help as well. and again varied fruit. It's no good eating all bananas because they can bind us quite a bit as well. So banana, apple, blueberries, raspberries. Try to think about eating the rainbow. Other things when we go to the toilet is avoiding straining. So again with constipation, when we're talking about poo, is trying to toilet properly. Now in the Western world, toilets are kind of higher up. So the way we should toilet, if you've ever watched a toddler or a baby, is to get into this position where you're sort of squatting, okay? Now this is not safe to do on a toilet, it's very dangerous, you might slip off and fall or hurt yourself. So actually you can get something called a squatty potty, as you can see here. I'm going to demonstrate in a second. You don't have to buy one of those, they are quite cheap on eBay. You can pick them up for like £5, but you can use toilet rolls stacked up and sort of wrapped up, or a kid's little stool if you've got children. Now what this does, if you imagine this is a toilet, okay, as you can see now, I'm in this position where my hip is slightly higher than my knee. So if I want a toilet, sometimes sitting on the toilet, the other thing we tend to see is people sort of will sit on the toilet and then they'll sit like this to empty, so they're slumped down. So ideally you want the stool there, you want your foot on the stool so your knee's higher than your hip, and you want to try and really maintain a straight back and lean forward slightly so that you can relax into your arms and open your bowels. It helps the pelvic floor muscles relax properly to be able to empty the bowel, so that your rectum can just pass. That alone can help some people with constipation. And the other thing we're going to go through now is a moo to poo. So again, you can YouTube this video, moo to poo, and I'll go through it with you now as well. So it's because when we go to the toilet, sometimes we have to start off, and if we go to strain, what that can do is switch on the sphincter at the bottom, which actually makes it more difficult to go. So I want you to all have a little go. I want you to put your hands onto your lower tummy, and I want you to go moo, and then I want you to go moo, moo, and moo, and you will feel what we call a bulge and then a brace. So rather than trying to sit there and go and strain, you want to moo and then ooh, which helps just try and help you go to the toilet without straining. Okay, so try these things. They are simple things that will make a big difference as well. And then the other thing with toileting that we see a lot of is people have fear of sitting on toilets and public toilets. So again, if you're a bit worried, wipe the toilet seat and sit down. Try not to hover, and try not to sit on toilet roll, which encourages germs up. So wipe the toilet seat and sit down. Realistically, you're actually only sitting on your thighs. You're not sitting on your vagina or anything, so you're not going to catch anything from a public toilet. I think they're most of sort of the tips and tricks really with sort of bladder and bowel at the moment. Other things with the bladder that come up a lot with overactive bladder and the habits we develop is a lot of just in case we. So I'm going to go to the toilet just before I leave the house, and then the phone rings and then I go again 5 minutes after. Physiologically, there is no way your bladder is going to be completely full of urine within 5 minutes, so trying to bear that in mind. Same when you go out, so if you know you're going to go on a journey that's 20 minutes and you went to the toilet 5 minutes ago, try and think about there's going to be a toilet realistically somewhere that you're heading towards, and petrol garages and things like that have toilets too. Try and be aware of what you're saying to children, and go away before you get in the car. A lot of this is learned behaviour as well. Toilet hunters, so people who know where toilets are. So if you go to Lakeside, you know there's one at one end, the other end in the food court, because you know exactly where they are. So you know where toilets are, use them if you need to go. The other thing that's not very good is ignoring the urge to go for too long. Same for the front and the back passage, and we see this a lot with teachers, nurses, and people that have to hold on for long periods of time. So it's not healthy to do that either. Try and go to the toilet for 2-3 hours, providing you're drinking plenty of fluids.